Thank you, Alex. Good morning, everyone, and it's an honour to be here with you, and I am so impressed with the surroundings. My presentation says that it's about the UK landscape, but before I talk about the landscape, I'd like to begin by using the phrase open. Britain is open. Now, I appreciate you may have heard some news about how maybe Britain might be exiting something. And I want you to think about something that we feel very strongly, that our partnerships, that our relationships, our collaboration need to be stronger than ever before. Because despite the politics of it all, there's something valuable about what we've created together. And that's really why I want to talk to you about the UK landscape. Because there may be opportunities to work together with other countries, but I don't think anyone is calling you with the same warmth and the same respect and the same common values that Britain is calling to you now. Let's continue the research and let's do more of it. So when I speak to you about the UK landscape, and by the way, I have to thank a colleague for these slides, they're not mine. It's no longer science fiction. Do you feel that artificial intelligence, when you see it on the news, it feels a bit like we're talking about Skynet, the Terminator, they're going to take over the world. I want you to think about how doctors and also really commissioners, regulators are thinking about artificial intelligence. For us, artificial intelligence is to augment the human, not to replace. For us, it's about software that can make decisions independently. So which decisions? Now, I'm going to be honest with you. This might sound stupid. Bear with me. Computers are not intelligent. Computers do what you program to do. So if we can program them in a narrow artificial intelligence sense, they will do what's required. So we shouldn't worry about science fiction. We should be worrying about our imaginations. Because based upon what you can imagine, the use case, we can train software to make those decisions. Lots and lots of different examples for you. To give you an idea of some of the companies that we're talking about in the UK, we have an organisation that is using artificial intelligence, machine learning and deep learning on breast cancer imaging. And we have a gold standard. In radiology, you need 2 radiologists to look at a scan to decide whether there's malignancy. But neither of them should know the answer of the other, should be blinded. But we don't have enough radiologists. So the gold standard isn't being achieved because we don't have the workforce. There's just not enough capacity in the system for all of the imaging that we need. So a company called KieranMed, they trained 1 million images on a system they call Mia. And they called it Mia because they didn't want it to sound scary. They wanted it to sound human. And Mia acts as your second check. And if it disagrees with the human, then it calls again for another human being to come in and take care of it. But those are the ways that we use machine learning and deep learning and other elements of artificial intelligence, not to replace, but to augment. Because we face a struggle where there are too many people with chronic conditions. We have to do too much screening. We don't have the staff. We don't have the money. Artificial intelligence offers the opportunity for us to be advanced and actually consistent. So why the UK? You may say, especially in healthcare, that America and their hospitals have got lots of money, lots of resource, and they do. China and India are producing graduates at a scale that no one can compete with. So Britain's decision is to add immense value where it can, to harness its heritage, and the heritage is having science and innovation for hundreds of years. To say that we've got the best medical schools, the best academic centres in the world. We have a culture of innovation And as you can see, there are various elements of what you might call the UK offer that are very attractive. And we are not saying that it's us alone. We're saying share the innovation. If you have something that you're doing, perhaps in Austria, then share it with us. Test beds, innovation. So to give you an example, there's a company in Nottingham, which is in the UK, and it's worked out using magnetic resonance that it can detect cancerous cells within 8 seconds. Now, this may surprise you how it does it. The idea is that cancer cells have a different magnetic resonance. So if you have a sample, you put it into the box, and a magnetic tip moves over the cells. And based upon how that magnetic tip moves, there's a graph. And the machine learning algorithm can identify whether it's a graph that moves too much or a graph that doesn't move enough. And it can tell you within 8 seconds that this is likely to be a cancerous sample of any cancer, of blood cancer, whatever you like. Those are the kind of innovations that are there. We're helping them as Department of International Trade to get out to India, because rural areas do not have access to healthcare. They don't have access to screening. You need to put this kind of technology in the hands of people who need it. So technology here isn't about keeping it and holding it in your national borders. It's about what we can do to diffuse it and spread it. And that's the call that we make to you. There is a huge market opportunity. And I'm sure you know that already. Within each of your nations, there are market opportunities. There is something, though, about money, which London in particular does very well. The funding that's available, venture capitalists, private equity, whatever you like, whenever you think about how you can get funding and how you can go further, there seems to be a big advantage. And whenever we use the NHS, the National Health Service, as a brand, and we take it to other countries, somehow it seems to work very well. The national brand works very well. So what we've seen is innovations from different countries coming to the UK, being embedded in the National Health Service, proving itself there, then exporting even further. That's what we call to you as a market opportunity. There's heavy government support. I've already been given the 5-minute warning, so I'm going to walk quite quickly through this. We believe, and I mean this honestly, we believe that you cannot leave things organically just to grow. It needs a nudge. So that's what we're doing. These are examples, and the slides will be made available to you as we go. But the government initiatives are advancing. We have an artificial intelligence sector deal that's close to $1 billion in investment. You'll notice in the middle there, 200 PhDs are being funded in artificial intelligence. We are making a play in Britain to be a place where the capacity, the skills are available for us to advance. Not just our technology and innovation, but the world's. There are grand challenges that we need to solve. Industrial challenges, healthy aging, clean growth, future of mobility, but artificial intelligence and data is the first. That's a big play for us, and I hope it comes across to you when we speak about how the UK is a place and a partner, that this is something we take very seriously. There are clusters. If you know anything about the UK, you'll know that some of the best universities are in these clusters. One thing I would mention that is not actually on any of my slides is that we have a concierge service called MedCity. And MedCity says if you have an innovation, or if you're a pharma company, you want to come in and do some work, come to us and we will find the best partners for you. We will help you with contracts, we'll help you to set up. And MedCity is part of what they call the Golden Triangle, which is London, Oxford and Cambridge. So if you want to come into the UK and do some work, MedCity will support you. And that's just that part of the country. What about Birmingham? What about Manchester? What about Edinburgh? What about Glasgow? The UK is open. And as you can see, more universities, more skills. Have you heard of Alan Turing? Strangely, a lot of British people, when they heard the name, they didn't associate him with what we're talking about. Machine learning, data science, artificial intelligence. The Alan Turing Institute is set up to be the National Institute for Artificial Intelligence, although they've changed the name recently to data science because it's broader. But AI is their focus. If you want to come and speak to the greatest minds in the world about your advancements, Alan Turing will make sure that happens. Wonderful people, really they are. And they're based at the British Library. It's all about openness, all about learning, and I would definitely recommend a conversation if you're in the field. I've been given another warning, so I'm going to move quick. If you have any questions about funding, I can go into more details. I'd like to focus on the one in the middle, Innovate UK. Innovate UK is not about academia. It's about getting things to market. If you want to get something to market, Innovate UK will give you the funding to do so. That's the kind of work, that's the kind of acknowledgement we have, that you can't just leave these things to chance. And there are many groups, too many to list really, that are here supporting. And there's none of the conflict, none of the Cold War or Civil War between these organizations. There is a common goal here. Trade shows, as you can imagine, the UK is full of them. We even have incubators to help entrepreneurs push. And of course, the skills. If there's something that you need, I think you're going to find it in the UK. So on that note, I'll finish with an elevator pitch. These are the strengths of the UK. But the one word I've missed out here is our openness. We call to you to continue the journey together, regardless of the politics and the news. And we hope that we can work together. My very last slide is to thank my colleague Chris Moore, who produced these slides. He focuses more on inward investment into the UK. I think I focus a little bit more on the export side, but I'm very happy to continue the conversation. Thank you.